I've now been practicing as a physical therapist for nearly 15 years, and that feels bizarre to say out loud. And when I think about some of the things I'm seeing now versus when I started, one of the things that jumps to the front of my mind is the prevalence of people that come in with the belief that they are hypermobile, or maybe they've even been diagnosed with a hypermobility related condition such as Ehlers-Danlos or hypermobility spectrum disorder. And in many ways, this is a great thing because now it shows we are more aware of these different issues and the challenges that they can present. So if you have something like a hypermobility issue where maybe you have pain in a variety of different joints because of hypermobility, you've been diagnosed with that from some other medical professional, that may be a different story than some of the things I'm going to talk about. And in that case, we need to dive a little deeper into some of the other confounding variables that you may be experiencing because there's usually going to be other issues involved, such as some GI issues, as an example. But if you are an athlete or a really active person and you just believe or been told that you are hypermobile and that maybe has given you some problems, or in many cases, even given you benefits, because being hypermobile can be a benefit if you're going to gravitate towards certain sports like gymnastics or dance or even baseball. Think about baseball, your arm has to get into these extreme positions to be able to throw really effectively. One of the reasons why I don't have a great arm is because I'm kind of stiff and can't really get back there. And all of us live on a little bit of this spectrum where some people are naturally a little stiffer than others. And that's okay. That's normal within a range is to be expected. The extremes, such as an Ehlers-Danlos, for example, that's where some problems can occur, and we would approach that a little differently than what I'm about to discuss. So if you're somebody who's a little bit more mobile, say hypermobile, and you've had some pain problems or you're just looking to optimize your performance, we need to approach that a little differently. For obvious reasons, we're not going to think about stretching as much because you have plenty of flexibility. Your soft tissues are like loose elastic bands where they can get into these positions very, very easy. But in this analogy of a loose elastic band, that elastic band needs to get a little bit more stiffness so it can have a little bit of that protection. So if it gets stretched too far, it can put on the brakes and protect itself. And also, when we have a little bit of that stiffness, it's also going to give us some more athletic qualities, a little bit more of that spring that oftentimes people who are very hypermobile can lose because the little sensors within our tendons and ligaments that give us a little bit of that sort of bounce response. Think of your knee when you go to the doctor and you get hit with the reflex hammer. That's what that's triggering. That can be dampened when you're very, very loosey-goosey. And so with training for an athlete or somebody who wants to really get after it in their day-to-day, what we need to think about doing is, as opposed to stretching and things like that, are strength training to develop some of those stiffness qualities. In addition to just basic foundational strength training, which is really important in the starting point, one area we may want to get into are isometric drills so that we can work on building stiffness and strength in very specific positions by having someone stay in a position, work muscles, load the tendons and joints in a very specific place that is well tolerated for you, symptom-free, and that will facilitate the joint to having some more protective stiffness in that position. I'm going to include a couple of videos here that talk about that. It could be something simple like a wall sit, or even a split squat hold where you hold the position to create some stiffness around those knees, because that, for example, is a joint that a lot of people who are hypermobile can have some problems with. You may notice that they tend to overextend or hyperextend those knees beyond 0 degrees. That's usually a good sign that hypermobility may be an issue. Maybe we even have pain in those joints partially related to that. In addition, after we go through the isometrics or basic strength training stuff, one area that is really helpful to work on as well is end range strength training. Basically performing strengthening exercises at end range of motions where I probably can't get to, right? I'm not going to be able to get my arm all the way behind my head because I just don't have that kind of mobility naturally. But a hypermobile person does, so they need to actually learn what to do when they get there. Maybe develop or work on strengthening in those positions. So here's a drill. I'm filming it, so again, take that with a grain of salt that I can't get into the position that a really, really mobile person can. But imagine that somebody with hypermobile shoulders is doing this drill. They would do it closer to their end of the range of motion because they can get there. So, what happens when they do? Do they know how to protect themselves and generate force in that position using the muscles that are working together to protect, in this case, maybe the shoulders? Because these end range positions, that's also where we're a little vulnerable to injuries, or in regards to the shoulder, some dislocations. So, if you're somebody who is a more mobile or hypermobile person, and even if you're somebody who's been diagnosed with a hypermobility related disorder or something like Ehlers-Danlos, and you're looking for some more of a strengthening routine that may be helpful to create some protective stiffness around the joints, contact us. We can create a strength training program, for you that will specifically address the areas that you may have some discomfort or problems as it's related to your excessive mobility. If that's something you're interested in, contact us. As always, we would love to be able to help you.